Nobody talks about this one. Not the insurance companies, not the Medicare website, not the financial advisors who help people plan their retirement. And the reason nobody talks about it is not because it is rare. It is because by the time most people find out it happened to them, they are already too far in to fix it. The mistake I am about to describe is happening right now to seniors across this country, quietly, invisibly, on a bill that arrives every month and looks completely normal. Until you know what to look for. If you are on Medicare or approaching it, stay with me. Because this one is different from everything you have heard before. His name was Frank, 69 years old, retired insurance broker from outside of Columbus, Ohio. And before you say anything, yes, he worked in insurance. He understood policies. He understood premiums and deductibles and coverage gaps. He thought he understood Medicare. He had helped clients navigate it for years before he retired. He felt more prepared than most people ever are. And he still made this mistake. Frank enrolled in Medicare at 65 without any issues. He chose a Medicare Advantage plan, a good one, with a solid network that included all his doctors. He reviewed it carefully. He compared plans. He felt confident. And for 4 years, everything worked exactly as he expected. Routine visits, a few specialist appointments, prescriptions filled without drama. Then, one October, Frank did something he had done every year since he enrolled. He sat down with his annual notice of change, the document Medicare Advantage plans are required to send every fall, and he read it. And this is where it gets expensive. Because buried on page 11 of a 16-page document, Frank found something he had never noticed in the previous 3 years. His plan had quietly changed the formulary tier for one of his medications. A drug he had been taking for his cholesterol for 2 years. It had moved from Tier 2 to Tier 4. His monthly cost for that one medication was about to nearly triple. But that was not the mistake. That was just the trigger. The mistake was what Frank found when he started pulling on that thread. He went back through his explanation of benefits documents from the past 2 years. He compared what he had actually paid against what he should have paid under his plan's terms. And what he found shocked him. Not because his plan had been billing him incorrectly, but because he had been making choices, small, quiet, routine choices, that were costing him money he never had to spend. He had been seeing an out-of-network lab for his annual blood work. Not intentionally. His doctor's office had referred him there years ago, before he was on this plan, and he had never thought to check whether it was in network. It was not. For 2 years, he had been paying an out-of-network lab rate for tests that could have cost him almost nothing at an in-network facility. He had missed the annual enrollment period 2 years in a row because nothing dramatic had happened, and he assumed his plan was still the best option, without actually comparing it to alternatives. In those 2 years, a competitor plan in his zip code had added his cardiologist's preferred hospital to their network and lowered their out-of-pocket maximum by $1,500. Frank had no idea, and he had a prescription drug plan that had not been reviewed since he first enrolled. 2 of his medications had moved to higher tiers. A generic had become available for one of his most expensive brand-name drugs, a generic that was covered at a dramatically lower cost under several plans available to him. But because he had never reviewed his Part D plan, he was still paying the brand-name price. Frank added it up. 2 years of unnecessary out-of-network lab costs, 2 missed enrollment periods where a better plan was available, overpaying for medications that had cheaper alternatives. The total came to just over $4,000, money he had spent without realizing he was spending it, because he had done what most people do. He had made his Medicare choices once, felt good about them, and moved on. And this is exactly where people lose money. This is the biggest Medicare mistake that retirees make, and nobody talks about it because it does not happen in a single dramatic moment. There is no shocking bill that arrives out of nowhere. There is no phone call delivering bad news. There is just the quiet, steady draining of money from a retirement budget because Medicare is a system that changes every year, and most people treat it like a decision they made once and never have to revisit. This is what most people do not realize. Medicare is not a set-it-and-forget-it system. It is an annual system. Every single year, the rules change. Premiums change. Formularies change. Networks change. Out-of-pocket maximums change. The plan that was right for you last year may not be right for you this year. And the cost of not reviewing your coverage annually is not theoretical. It is real money, real dollars, leaving your retirement account every month because you assumed nothing had changed. Let me break down exactly where the money disappears, because Frank's story is not one mistake. It is 4 separate categories of mistakes that happen quietly and independently and add up to thousands of dollars over time. The first category is formulary drift. Every Medicare Part D drug plan and every Medicare Advantage plan with drug coverage uses something called a formulary, a list of covered medications organized into tiers. Tier 1 is typically the cheapest, Tier 4 or 5 is the most expensive, and that list changes every year. A drug that was on Tier 2 in January can be on Tier 4 by the following January. Your monthly cost for the same medication can double or triple without any change to your health, without any change to your doctor's recommendation, simply because the insurance company renegotiated its contracts and moved your drug to a different tier. Most people never find out until they are standing at the pharmacy counter and the number on the screen is larger than they expected. By then, the annual enrollment period, the window to switch plans without penalty, has already closed. They are locked in for the rest of the year. The second category is network erosion. Medicare Advantage plans update their provider networks every year. Doctors and facilities leave networks, new ones join, and your plan is required to notify you in the annual Notice of Change document that arrives in the fall. But that document is long and dense, and most people set it aside. Then in January, they show up for an appointment and find out their imaging center, their lab, or their specialist is no longer in network. Every visit now costs more than it did last year, and they had no idea it was coming. And this is not even the worst part. The third category is plan complacency during annual enrollment. Every year from October 15th through December 7th, Medicare runs what is called the Annual Enrollment Period. During this window, you can switch Medicare Advantage plans, switch Part D plans, or move between original Medicare and Medicare Advantage. And every year, new plans enter the market in your zip code. Existing plans change their premiums, their out-of-pocket maximums, their drug formularies, and their networks. A plan that was the best option for you 3 years ago may now be the third or fourth best option. But if you do not compare during the annual enrollment period, if you simply let it pass because nothing feels urgent, you are making a choice by not making a choice, and that passive choice can cost you money every month for the next 12 months. Frank missed 2 annual enrollment periods in a row. Not because he was careless, because nothing dramatic had happened and he did not feel the urgency. But in those 2 years, the market around him had changed. Better options existed. He just never looked. The fourth category is the out-of-network habit. This is the quietest and most invisible of all. People develop routines over years, a lab they always use, a pharmacy they have been going to for a decade, a specialist their doctor refers them to consistently. And when they change insurance plans, they do not always audit every single provider they use against the new plan's network. So they keep showing up at the same places they have always gone, assuming coverage is the same, not realizing that some of those providers are no longer in their network. The out-of-pocket costs accumulate slowly, one claim at a time, until someone actually looks at the pattern and adds it up. Now here's what I want you to understand about all 4 of these categories. None of them require you to do anything wrong. You do not need to be reckless or uninformed or irresponsible to fall into any of them. You just need to do what most people do, make a good decision once and assume it stays good. That assumption is what costs the money. What happened next in Frank's story surprised him. Not in a bad way this time. When Frank finally understood the full picture of what had been happening, he did not feel angry. He felt motivated, because he realized that everything he had lost was recoverable going forward. He could not get back the $4,000, but he could make sure it never happened again. He marked the annual enrollment period on his calendar, October 15th, not as a reminder to check his mail, as a standing appointment with himself to actually compare every plan available to him in his zip code against his current medications, his current doctors, and his projected medical needs for the coming year. He started using Medicare's official plan finder tool at Medicare.gov, which lets you enter your specific drugs and dosages and compare the total estimated annual cost across every plan available in your area. He stopped assuming. He started verifying. He called his doctor's office and asked them to run a check on which labs and imaging centers in his area were in his plan's network. He updated his pharmacy to one that was preferred under his Part D plan, which lowered his copays on 2 of his medications immediately. And when the next October came around, he switched plans. Not because his current plan was terrible, because a different plan covered his medications at a lower tier, included his preferred hospital and network, and had a lower out-of-pocket maximum. He would save an estimated $900 in the coming year just by switching. $900. From one afternoon of comparison shopping during the annual enrollment period. This is what most people do not realize. The annual enrollment period is not just a formality. It is the single most powerful financial tool available to every Medicare enrollee every single year. It is your opportunity to course correct, to respond to the changes that happened in your plan over the past 12 months, to take advantage of new options that were not available when you first enrolled, and it costs nothing to use it. The only cost is the hour or 2 it takes to actually compare your options. Frank told me that the thing that bothered him most was not the $4,000. It was knowing that the tool to prevent it had been available to him every year. The annual enrollment period, the plan finder, the free counseling, everything he needed was there. He just did not know he needed to use it, and he is not unusual in that way. The annual enrollment period gets almost no attention compared to the initial enrollment process. When you first sign up for Medicare, there are letters and deadlines and decisions that feel urgent. But once you are enrolled, the system assumes you know to come back every October and reassess. Most people do not. Most people receive the annual notice of change in the mail, set it aside, and move on. And every year they do that, they are potentially leaving money on the table and paying more than they should for coverage that may no longer be the best fit for their life. This is the mistake nobody talks about. Not because it is complicated, because it is invisible. It does not announce itself. It does not send a warning. It just quietly takes money from your retirement budget month after month while you assume everything is still fine because you made a good decision once. So here is what I want you to do with what I have just told you. First, pull out your most recent explanation of benefits documents and look at what you have actually been paying for your medications and your medical visits. Compare those numbers against your plan's current cost-sharing structure. If anything looks different from what you expected, find out why before the annual enrollment period opens. Second, in October, do not let the annual enrollment period pass without action. Go to Medicare.gov and use the Plan Finder. Enter your medications, your dosages, and your preferred pharmacy. Look at your total estimated annual cost across available plans. Compare it to what you are paying now. If a better option exists, switching is free and takes less time than you think. Third, call your doctor's office once a year and confirm that your regular labs, imaging centers, and specialist offices are still in your plan's network. Do not assume. Networks change. A 5-minute phone call can prevent a year of unnecessary out-of-pocket costs. And fourth, if you want help doing any of this, your State Health Insurance Assistance Program, SHIP, offers free one-on-one counseling from trained advisors who will compare plans with you at no cost and with no sales agenda. Find your state's program at Medicare.gov. Frank is saving money now, not because his situation changed dramatically, because he started treating Medicare like what it actually is, an annual decision, not a one-time choice. You can do the same thing, starting right now. The next video covers one of the most dangerous threats facing Medicare enrollees today: scams specifically targeting seniors using Medicare as the entry point. If you or someone you love has ever received a call, a text, or a card in the mail about Medicare benefits, that video is essential. It is coming up next.